quite a lot in all the facets, either it is in the hospital setting or in the private home settings also. Now, if we see, health systems have struggled to provide wide scale testings. The sooner the infection is spreading, the lab is not able to take up that much of load. So the government has tried out new strategies and to scale up the diagnostic test so that we get an early diagnosis, so that early isolation can be done at the site of collection of the specimen. That is the name point of care test, where you are taking care of the patient at that same place, you are also performing the test. Now, where do we do these tests? Like physicians' offices, urgent care facilities, emergencies, pharmacies, and school health clinics, long-term care facilities, nursing homes, and even temporary locations like we have experienced when it was done in the hotels. A lot of people had come and they had to be sheltered in the airports, bus stands. So all those places you can easily perform point of care tests. Now, the advantage is that you get a result within 10 to 20 minutes depending upon the kit that you are using, and it can be done out of the lab also, mainly out of the lab, and it reduces the burden on the resources. We have limited number of machines, limited number of tests that can be performed by molecular test. So only those cases which are coming doubtful or are symptomatic and still coming negative by point of care test can go for a RT-PCR. So therefore you are trying to share the burden of the lab. And also in the containment areas, which areas need to be contained, where you are getting more cases. So it's a very fast way which you can come to know. Apart from that, it also helps the policy makers and the experts to gauge the number of symptomatic and asymptomatic cases in the general population. Now, specimen collection and handling of the point of care test, if we see, there are kits that are authorized by Indian Council of Medical Research, which we have to use for these tests. And what happens is that these kits are standardized for a sample. Some may be standardized for nasopharyngeal swab, some may be for the oropharyngeal. For some, it may even be bronchoalveolar lavage that you are taking, or a suction that you are taking may be applicable. So you have to see the kit and what kit is standardized for which sample. So you have to limit your sample to the kit that you have. You have to take the sample very, very clearly. You cannot just put the swab into anterior nares and expect the results to come from nasopharyngeal. So you need to know how much to go into the nasopharynx. So all these instructions are already given in the kit's guidelines. There are manufacturing instruction. It's a paper folded which is kept inside the kit inserts. You have to read it very carefully. Individuals who are collecting the samples have to maintain proper infection control precautions. They cannot dilly-dally in that. And they have to wear complete personal protection equipment because the infection spreads through aerosols. Not only those individuals who are doing the sampling, but also those who are testing the samples. They also need to maintain very high level of standard precautions because they are also at a risk of getting infected. Now, a very important part which is generally overlooked is the disinfection of the surfaces. The area where you are taking the sample, the area where you are testing the sample has to be disinfected from time to time. So if you keep a protocol of that area, it is very easy. You can do it at the beginning of the day. When you have between the samples, when you are collecting, you need to wipe the surfaces. Make a routine every hourly. You can disinfect the area. If the area is soiled, visibly soiled, suppose you were taking a nasopharyngeal swab or an oropharyngeal swab and the patient gagged and vomited, it needs to be cleaned immediately. And sometimes the specimen spills, there is a splash. In those situations also, you need to take the correct precaution and disinfect the surface. And once you have finished off for the day, again you need to disinfect. Another very important part which leads to error of these point of care tests is the sample, the kit itself. Now we should realize that these kits are tested made and validated under very controlled environmental conditions inside a lab. They are not tested in the peripheries, outside the lab. So what happens when you are testing it outside the lab, when you are testing it in a nursing home or on a bus stop or in an airport, and the temperatures are not ambient, it may be raining, so the temperature goes down, or it is cold like these days. So these point of care tests may give you an erroneous result. So you have to take care of those situations and keep this thing in mind. Now what happens is, these kids, they have got generally they are the lateral flow assays, and they have got a nitrocellulose membrane on which the sample flows. If you keep the sample, the skit cut and open for a longer time, it may absorb the moisture, and then your results may vary, or may get a erroneous result, or may get a inconclusive results. So therefore, what you need to do is read the manufacturer's instructions very carefully. I am not giving the details of manufacturer instructions because the kits can vary from time to time. And you should store the reagent, store the kit, store the sample as per the manufacturer's guidelines. Do not keep the kits open for a long time. Suppose you expect to get 20 patients, so you cannot just take out all the kits, put it on a line and wait that you will be doing these tests. When you get a sample, you open the kit and perform the test. Do not pre-open the kits. Now another thing is that you have to read the result also. Reading of the results in point of care testings is very simple. You get one line, which is a control line. You get a control line, it is a valid test, you have performed the test properly. If you get another test line, that is a positive line. Now only catch here is that you have to go back to the manufacturer instructions, and you have to look into the time which is required for you to read the result. Normally, if you read the manufacturer instructions, in one slip there is a flow chart. You can just cut it and paste it in the area where you are going to test, and you have to wait to read for 15 minutes or 20 minutes or half an hour, depending upon the kit. Then only give the result. Don't be in a hurry that you have put the drop, the control line has come, and you are giving the result. Wait for the stipulated time and then only read out the results. Last but not the least is the waste disposal. You should know where to dispose of the swabs which you have taken and the kits you have taken, because again it has to be handed over to the biomedical waste for proper disposal. And here what they say is they have categorized these tests into two parts. Either the general geographical area or the city has got either a containment zone where their cases are more, or there is a non-containment zone. In containment zone, the ICMR advisory is that you should use these rapid antigen tests. And at the point of entries also, from the state or from the district, depending upon the guideline at what point of time you are doing the test, if this test is coming negative, the person has to be confirmed by a RT-PCR test if the individual is symptomatic. And in a non-containment zone, you have to stick to the RT-PCR or a TrueNAT or a CBNAT. That means a nucleic acid amplification related test in a non-containment area, where generally the sample size or the people coming for testings is low. Now all symptomatic individuals who test negative by a rapid antigen test, they have to be tested by RT-PCR. Then you have to go for a RT-PCR. You can go into the site of ICMR and look for the advisories. There are links which are given, and one point I want to make out is that this ICMR has to be uploaded. All the results have to be uploaded on ICMR portal. All the vaccination status, the patient's address and the history of the travel have to be uploaded on the RT-PCR app. These uploaded results can be downloaded by the individual citizens from another app, another link of ICMR on the Android phone as well as the computer. Just giving a word about the Omicron, that this Omicron is a variant of Delta virus, and it has become so different that it has been given a different entity. So for this, genome sequencing is required, and it has no importance in the rapid antigen test. It is left only for the surveillance purpose. Thank you.